Hello, everybody. Thank you for inviting us to talk with you. Dr. Palmaville and I are from the Fresno State Speech and Hearing Clinic. We have a Parkinson's research clinic that we would like to share with you. We were contacted by Parkinson's Voice Project in Richardson, Texas, and offered a grant every year for the past 5 years in order to bring this program to Fresno State. So we're really excited to keep it going and to build our clients and help people in our community. Again, I had mentioned this is Dr. Palmaville. She is a tenured faculty member with us who is responsible for the research that we conduct in our Parkinson's research clinic. She gathers the data, she coordinates the student theses, and helps us to publish articles based on our findings, which is really exciting. My name is Sabrina Nii. I'm the clinic director in the Speech and Hearing Clinic, and I'm responsible for matching students and clients and supervisors and make sure that everybody knows where to go so that we can provide those services to our clients. Our website address is there. There's a QR code as well that will allow you to access our basic website so you can see all the clinics that we have offered, and you will see a research clinic, a Parkinson's clinic, as one of those options when you view it. What we do in our clinic. We do more than just research, and we do more than just Parkinson's. We offer clinical services to a variety of people in our community, from about 1.5 years old all the way through the end of life. We provide clinical training for our graduate students. They're required to earn a certain number of hours while with us in our program, and we make sure that we provide that to them on our campus. We provide required observation hours for those undergraduates who are coming up and hope to join our program. And we conduct research and provide theses opportunities for our students. So there is research always going on, and we hope to publish all of those things as we complete those. We have a variety of different types of clinics. We have clinics for children, diagnostics, where we just have them come in for testing so that we can offer them a speech and language diagnosis, a preschool for autism, a preschool for early intervention, young kids acquiring and learning language and speech, individual clinics for any type of need. There's fluency, there's voice, there's language, there's speech. There's a variety of different clinics that we provide to our clients. And then we have our adult side, which is what we are here to talk about today. We have diagnostics as well, where we could go in and diagnose individual clinics for a variety of issues, brain injury, stroke, Parkinson's, and other issues that a person of the adult age could experience. And then why we're here is to talk about Speak Out and Loud Crowd research clinics for people with Parkinson's disease. So that's just, as you could see, a portion of what we do in our clinic. There are 2 parts. Is this yours?
Just keep going.
Okay, there are 2 parts to our program. The first part is Speak Out, and the second part is Loud Crowd. And again, this is directly from Richardson, Texas, the Parkinson's Voice Project. Part 1 is that you will come to our clinic twice a week for 35 to 50 minutes, depending on your needs, for 6 weeks. At that point, we teach you the program. We show you how to use it. We give you the skills so that you feel comfortable in all of the activities. And we're taking data on your progress. We're keeping that data without your names, of course, but we are keeping that data and we're using it to help prove that this program is definitely worthy and works well for our clients, and to continue to build that that wealth of research that is needed in this area. Part 2, after you finish the first 6 weeks, then you come once a week. And you can choose to come in to our clinic once a week, or you can choose to join us on Zoom. It's a hybrid situation. So if you're not feeling up to it that day, or you're traveling, you are welcome to come in or use our Zoom link and join us in our practice sessions. We've been doing the hybrid now for some time, and it works really well, and it's a lot of fun. And this is meant to maintain your skills. And this is something that is perpetual. You just keep coming to us every semester. And if you experience issues with your speech, you notice a decline, or you need a refresher, we can put you right back into the individual clinic where you can join us for 6 weeks, twice a week, and then rejoin us in our Loud Crowd group again. So it's something that's meant to be lifelong, that we can help you throughout the course of the Parkinson's, depending on where you are at the time. Did you want to continue? Is this yours?
I don't remember. So I just keep going.
Okay. So let's talk a little bit about Speak Out. We will have a video to show you what that looks like, and I will also share with you what exercises look like. I think this is the video, the one that I show you. Okay, I will. So I wanted to share with you that 90% of people with Parkinson's are at risk of developing a weak voice and swallowing complications as well. Although our program does not focus on swallowing, that is not our primary concern. Learning how to use intent also positively impacts your swallowing ability as well, because you can employ the same skills of intention to your swallowing, which also helps. Parkinson's Voice Project developed a speech treatment program to help patients regain and retrain their speech and communication while minimizing the swallowing issues. And if you look at this wheel here, I think this is called the Wheel of Intent. This is directly from Parkinson's Voice Project, where you start out with an evaluation. You move out through, you get through the workbook, and you get a free workbook, and you get access to the e-library for practice materials. And then you learn about the Parkinson's webinar. You learn about the Parkinson's Voice Project through their webinar. You join us in our clinic twice a week. And then we do groups, okay? And then if you choose to come back, or you experience a decrease in your intensity of your voice, then you could come back through a refresher. We reevaluate, and we start that process over again. And you just join us. And it's on a kind of a 3 semester. So we do spring, summer, and fall. And so you get little breaks in between, and you can always rejoin us in our individual if you feel as though you need it.
Can I steal the mic for a minute?
Yep.
I don't know if I need that one. So I wanted to comment because this program is not designed to work on swallowing per se. Don't go too far, you're attached. And we have had clients that we're working with individually who have also had significant swallowing problems, and we have asked them to apply the same principles with their swallowing, and we've seen significant improvement. And we've also seen that, just to mention, some of you might have heard of the Lee Silverman Voice Treatment Program. This is a different program, but it has some similar components to it. And there's a lot of evidence supporting that program improves swallowing as well. So I just really wanted to emphasize that swallowing aspect as well as the speech aspect. Hopefully we'll get some data on that as well going forward. Thank you. You want to go to the next one?
Yeah. At this time, we'd like to offer it's a 14-minute video, but it really does, it's directly from Parkinson's Voice Project, and it really does explain to you in a way that we couldn't how this program works, how it was developed, and how it was created by Dr. Daniel Boone, and Samantha Ellen Derry took it over and made something great out of it. So I'm going to start the video now, and we'll talk more when it's over.
Houston, Texas, there's a nonprofit organization called Parkinson Voice Project, dedicated to teaching people with Parkinson's how to speak and live with intent. Intent means to be focused, purposeful, and deliberate, and to take back control over one's destiny, which was previously thought impossible with a diagnosis of Parkinson's. Let's start with the basics. Parkinson's disease was first medically described in 1870 by an English physician named James Parkinson. He wrote a manuscript entitled An Essay on the Shaking Palsy, where he described similar symptoms of 6 different people. In the essay, Dr. Parkinson wrote, "So slight are the first inroads of this malady, and so extremely slow is its progress, that it rarely happens that the patient can form any recollection of the precise period of its commencement. It can be difficult for those with Parkinson's to pinpoint when their first symptoms appeared, since the condition progresses so gradually. Some of the early symptoms might include tremor, slowness of movement, impaired balance, rigidity, and reduced writing size." About 55 years after Dr. Parkinson wrote his manuscript, Dr. Jean-Martin Charcot, a French neurologist, suggested that the name of the condition be changed from shaking palsy to Parkinson's disease. He thought that Dr. Parkinson should be recognized for his earlier work, and Charcot was adamant that not all patients had tremors, and that weakness was not a typical symptom of the condition. If you know someone with Parkinson's, you may be surprised by Dr. Charcot's observations about weakness. Let us explain. Parkinson's is characterized by smaller movements, smaller walking, smaller writing, and a smaller voice. Parkinson's does not make muscles weak like other neurological disorders might. Since the movements are smaller, the muscles are not being fully used and can, therefore, become weak. The old adage, use it or lose it, applies to Parkinson's. When patients first go to the neurologist, a blood test, CT scan, MRI, or other tests might be ordered. These procedures do not diagnose Parkinson's. They help rule out other disorders that may mimic Parkinson's. A diagnosis of Parkinson's is usually made through clinical observation, a thorough case history, and a neurological exam. When patients present with 2 out of the 4 cardinal symptoms, a diagnosis of Parkinson's may be suspected. A favorable response to Parkinson's medication is also valuable in terms of diagnosis. However, there could be other causes of the presenting symptoms, so it is important to be evaluated by a neurologist who is trained to distinguish these clinical differences, namely, a movement disorder specialist. The exact origin of Parkinson's is unknown, although scientists suspect that genetic and environmental factors, as well as exposure to chemicals and pesticides, could be possible contributors. Parkinson's affects 1 in 100 adults over the age of 60. When someone is diagnosed with Parkinson's before the age of 50, the condition is referred to as young onset Parkinson's disease, or YOPD. Parkinson's is not contagious, and although there is no cure, there is minimal impact on lifespan. April is known as Parkinson's Awareness Month, and the tulip is the international symbol. Parkinson's disease develops when cells in the brain that produce a chemical called dopamine die or become impaired. By the time someone has any symptoms of Parkinson's, as much as 80% of the dopamine in the brain could be depleted. To understand the role of dopamine, let's briefly explain neurons and neurotransmitters. There are billions of neurons in the brain. Neurons receive information from other neurons, process that information, and then send the information to other neurons. In this diagram, you'll notice that there is a gap between the 2 neurons, which is normal for all humans. This gap prevents information from being passed from one neuron to the next. It's like a short in an electrical circuit. This is where dopamine comes into play. Dopamine is released into the gap and helps transmit information from one neuron to the next. This is why dopamine is called a neurotransmitter. Dopamine specifically helps transmit impulses that control automatic movement. Since people with Parkinson's don't have enough dopamine, it becomes difficult to produce automatic movements. such as walking, talking, and writing. However, there is some good news. People with Parkinson's can control some of their movements with one simple concept: intent. You see, humans have two basic motor systems that control movement: the extrapyramidal system and the pyramidal system. The extrapyramidal system is responsible for movements we perform automatically without conscious effort, such as blinking, swallowing, and swinging our arms when we walk. The pyramidal system, on the other hand, is responsible for intentional movements, purposeful movements, such as putting on makeup, shaving, or learning to play the piano. Here are some simplified drawings of the brain that show the differences between the two motor systems. Impulses travel from the cortex down to the brainstem and spinal cord. Both motor systems end in the same place, but it's how they reach their final destination that makes them different. In the extrapyramidal system, there's a complex network of neural fibers that stop at various structures within the brain, including the substantia nigra, where dopamine is produced. Think of the extrapyramidal system as a country road that has extra stops along its path. Without enough dopamine, the extrapyramidal system doesn't work very well. This is why automatic movements are disrupted in Parkinson's. But in the pyramidal system, the neural fibers travel straight down without stopping. Think of the pyramidal system as an expressway. Since the neural fibers don't stop to communicate with other structures, this motor system works better for people with Parkinson's. Intentional and deliberate movements are preserved. We activate the pyramidal system when we consciously and purposely produce a movement. When people with Parkinson's use intent, their speech sounds clearer, they stand up straighter, and their handwriting becomes more legible. All of us have used intent throughout our lives. Think about a past job interview. Did you make a conscious effort to smile and make good eye contact? Did you purposely stand up straight and speak clearly? You were using intent. Have you ever been driving when suddenly you get caught in a downpour? Did you turn off the radio and put both hands on the wheel? You were using intent. What about when you exercise? Do you work hard to swing your arms, lift your knees high? Do sit-ups or push-ups with more effort? This is intent. At Parkinson Voice Project, we encourage people with Parkinson's to speak with intent. Say it like you mean it. Speak with gusto. And speak like you're the CEO of a company. When we speak with intent, our speech sounds louder, clearer, and more expressive. And once we learn how to speak with intent, we can start applying this concept to other movements like walking, writing, and living. Up to 89% of people with Parkinson's can struggle with speech production. Since speaking is an automatic behavior and the automatic system isn't working well. The early signs of a speech disorder can include a softer voice, a voice that sounds hoarse or scratchy, frequent throat clearing, trailing off at the end of sentences, and inconsistent production of the voice. Some days the voice sounds normal, and other days it doesn't. Parkinson Voice Project has developed a two-part therapy approach that helps those with Parkinson's regain and maintain their speaking abilities. Speak Out, followed by the loud track. Speak Out consists of 25 lessons laid out in a specialized workbook that includes speech, voice, and cognitive exercises. Speak Out workbooks are provided as a gift from Parkinson Voice Project to any person with Parkinson's in the United States who is being treated by a Speak Out trained speech language pathologist. Parkinson Voice Project appreciates donations to continue providing these workbooks at no cost. Here's an example of someone who completed Speak Out.
Have you noticed a change in your voice or speech? What did you notice?
I speak louder, clearer, and with intent.
Here's another example of progress that can be achieved through Speak Out.
Have you noticed a change in your voice or speech? What have you noticed?
I'm louder, I'm more confident, I speak with purpose, and I'm conscious of what I say.
Many of the muscles we use for speaking are also used for swallowing. So speech therapy isn't just about improving one's communication skills.
My voice is getting weaker, but my big problem is swallowing. I had a couple of episodes with weird death, actually. What I remember specifically was my wife was out of town, and I was having a sandwich at lunch table at our house, and took a piece of sandwich, and it didn't go down. And so we just stopped, and I stopped, couldn't breathe. I can remember thinking, this is what a ridiculous way to die, choking on a toothpick sandwich. Well, I can tell you that before the program, I noticed stuff would get a little stuck. And eventually go down if there's a problem with actually carrying through swallowing motion. And after the program, I just swallow like a normal person. I don't even think about it. Of course, I'm fairly religious about doing the exercise.
Something interesting about speech therapy for people with Parkinson's is that the goal of treatment is very different from traditional speech therapy. For example, when treating a child, the goal is to make speech production automatic. When a child finishes speech therapy, they won't have to think about articulating the syllables anymore. However, since the automatic system isn't working well for those with Parkinson's, the act of speaking will never become automatic. People with Parkinson's will need to exercise their voices every day, and will always have to be intentional about speaking. This is where the second part of Parkinson Voice Project Therapy program comes in, the Loud Crowd. The Loud Crowd is a maintenance program that consists of daily exercises, weekly speech groups, and regular follow-ups every 3 to 6 months. Some people might be reluctant to attend group therapy at first. However, these groups provide support, encouragement, and valuable education to both patients and their families, in addition to ongoing instruction by a speak-out-trained speech-language pathologist. At Parkinson Voice Project, the Loud Crowd also includes a singing program. Before we conclude, there is one more aspect of Parkinson's we want to mention. Besides its impact on automatic movement, dopamine can also affect one's motivational drive to get things done. So even though people with Parkinson's have the ability to get stronger, they may not be motivated to exercise daily and attend the necessary therapy sessions. This can be confusing and even frustrating for spouses and family members. They may even mistake the patient's apparent apathy as laziness or pure stubbornness. People with Parkinson's and their family members need to actively address challenges with motivation and find ways to exercise daily. Maintaining the ability to speak and to swallow depends on this. Friends and family need not feel sorry for the person with Parkinson's. Instead, provide assistance and encouragement by setting goals, establishing routines, and even exercising together. Thank you for taking time to watch this information session. Parkinson Voice Project's vision is that Speak Out and the Loud Crowd will be replicated all over the world so that people with Parkinson's everywhere will learn the benefits of speaking and living with intent. Parkinson Voice Project would like to send you a copy of the Loud Crowd step-by-step plan for living with intent.
All right, so that was a pretty nice little overview of what the Parkinson's Voice Project is, a little brief overview of what each the Speak Out and the Loud Crowd programs are. And I've been to Richardson, I've been to that program, and it really is sort of electric, and it's contagious and very exciting to be there because we're seeing some of the first people who started it, whose donations started the program, whose speech pathologists who'd been there and dedicated their life into bringing this program through the grants that they're giving out each year to people all over the world for nothing, for free. And that has been a really nice use of, knowledge and time and finances. Oops, excuse me. I'm gonna try to move on here. if I can. Okay. So what does a typical session look like? Upon joining our Speak Out program, Parkinson's Voice Project, we call them, we let them know what program you're joining, and then they send you a free workbook. And this is for you to use at home for practice. So you'll have that at home, you'll use it every day, but when you come to our clinic, we will have the books for you. And the sessions are set up in a very specific way, and the sequence is the same each time. So eventually, you'll get really good at it. They change slightly each session, but not by much. The sequence still remains the same. For example, when you first come in, there will be recordings. An assessment will be done, recordings of your before Speak Out, and a little bit of an interview. We will take a speech sample, and then we will introduce you to the concept of what it is to use intent, and then we will start with these lessons. So the lessons always start with a warm-up, which are these 3 exercises there. We also will do a counting exercise. Might be a little bit different each day. You might count by 5s, you might count by 100s, you might count by 3s, but essentially it's the same concept. There'll be reading activities. The reading activities are slightly different each time, and sometimes are themed based on what time of the year it is, winter versus summer. And then there are cognitive exercises that follow, and those cognitive exercises are different every single time, and they're really, especially in our clinic, and I'm sure in others as well, we try to make it fun, a little bit of a sharing opportunity. A lot of our clients know each other. They work out together. They're in groups together. And so we actually try to have fun doing this. I really enjoy the cognitive exercises. So I'm going to give you a brief example of what all of these look like. You'll get used to it. It's a little bit different at first, but it's actually a lot of fun when you get the hang of it. Okay, so the first warm-up exercises are may, me, my, mo, moo. And the goal is for you to use intent, to speak above a crowd, to be very intentional about what you're doing and what you're saying. And the syllables are to run together. So it'll sound something like this. May, me, my, mo, moo. And then we stop. And we'll do that about 5 times every single session, and that's again part of our warm-up exercises, and we do them all together as a group if you're joining our loud crowd group. We also have exercises. So the goal is for you to just continuously, for about 10 seconds, we don't have you do longer than that, that's not really beneficial, but 10 seconds of a really strong with intent. So you'll do this. Take a deep breath. And then at 10 seconds, which is the goal, when you'll stop. If you run out of air before that, just stop and wait, and then we'll start again. And hopefully, by the end of a semester, you will have at least 10 seconds of a nice, strong, intentional The third warm-up is a glide, where you start at the top, you pause, and then you glide back down to the bottom. So it sounds something like this. You stop and take a breath. So you're intentionally exercising your larynx and warming up your speech system for the next activity, which is counting. So in this particular lesson, which is the very first lesson that you'll be introduced to, it's lesson number 1, you start by counting 1, 2, 3, and it goes something like this. 1, 2, 3, 4, 5, 6, and you just keep going on. You do this 5 times as well to get your speech mechanism warmed up for the reading exercises. So you can see how we're building on skills. We're warming up and we're building up to more complex things. At first, we give you the stimuli. We tell you what to say. But then the cognitive exercises where you'll have to come up with responses, which is requiring you to use intent and develop something to say. And that actually is where the challenge comes in. So the reading exercises are just phrases, simple phrases like, good morning. Now, am I going to say good morning like this and accept that as something with intent? Not really, right? It's going to be animated. It's going to feel like it takes a lot of energy from you. But in fact, you will look and sound extremely normal because the Parkinson's, right? So if you say with intent, good morning, and you're using a lot of intent, you are louder, but you're using intent, so your voice projects further, and you have more expression as well. And believe it or not, even though some of our clients will say, gosh, am I over-exaggerating? Do I look funny and sound funny? You don't. You actually sound wonderful and more like your old self. Okay?
Can I steal?
Of course.
So this is a concept we call recalibration. So because of the Parkinson's, you might feel like you're doing a large movement or a large voice, but really you're not. And so through every activity, all the warm-ups, the reading, the cognitive activities, we are constantly measuring your voice. We have a sound level meter there. We're recording your voice, the loudness of your voice, the levels, and you are constantly getting that feedback on how your voice is doing. And through the process of doing the exercises and getting that constant feedback, your brain actually starts to recalibrate. So it becomes more aware of, you will become more aware of when you're mumbling, when you're using too soft of a voice, an awareness you may not have had before. And we'll get more comfortable with using a loudness level and a level of intent that might have felt awkward before. So this concept of recalibration is a really important part of speech training for individuals with Parkinson's. Even general movements. You know, you might feel like you're using a huge movement or a giant step, but you're really not. And so calibration can affect other aspects of movement besides speech.
The last part of each session is the cognitive exercises. So they could be a whole variety of activities. They could be sentence completion, they could be naming activities, they could be partner conversation, it could be a sharing opportunity about maybe your career before retirement or places you've traveled over the summer in your life. It's a whole variety of different things that keep your attention and are actually a lot of fun. So for example, I would do maybe like up and away. I would say cream and you as a participant would say, okay, cream and you have to come up with that word. Is it sugar? Whatever, right? So cream and sugar. And then I have you say, now say the whole thing. Cream and sugar. And then I say the whole group, cream and sugar. And we're using intent to practice the skill together as a group. And we try to move along quickly, and it's fast, and it's fun, and it's engaging. And you have to use intent in order to be successful and to be heard. So, and then again, it moves on to the next lesson. So it's a lot. Our students come up with very fun and engaging activities. The group is a lot of fun, and there's a lot of camaraderie, a lot of encouragement. And the students are very enthusiastic and fun to be around. So that's that part. That's what a session typically looks like. Now, the first 6 weeks, you're alone with your student doing these exercises. After that, you're in a group doing these same exercises. The program cost, $0. It is completely free of cost to the participant, including all of the books that you will use. In Speak Out, you'll receive a Speak Out book. In Loud Crowd, you'll receive a Loud Crowd book. And you will use these in your home to practice. In addition to that, Parkinson's Voice Project has hundreds of practice videos for you to use in your home when you're not with us, because it is a daily practice situation in order to continue to maintain your growth in your voice. We do gather data from our participants, but if you choose not to participate in that, you still get an invitation to join us. We will absolutely continue to have you in our program regardless of your participation or not in our program.
In the research.
In the research, excuse me. Yes, thank you, Fran. Signing up is actually pretty easy. There's a QR code, phone number, fax, email, but I've also put a packet, a small packet. It's called the Adult Case History Form. There's an address on the top that you can you can complete it, you can email it, you can send it, United States Postal Service, however you prefer to bring that into us, and that will alert me to your interest in the program, and then I will place you in our next available spot. Sometimes, like if you were to submit something to me this week, your first opportunity for joining us would be September, because we work on a semesterly basis. It's not like the wait list is very long, it's just that you'll have to wait until a new start of a semester to join us. So it's a really easy process. Again, just that paper. If you go online and click the QR code, the actual form will come up and you could just fill it in and email it back. It's simple. Okay, I think that's it. That's it, yeah. That's it. So, do you have any questions or concerns or thoughts about what you've heard here today?
Quick note, just remind Zoom that they need to unmute if they have questions, but also if you can repeat the question for them because they often can't hear what's being asked.
Oh, sure. If any of you on Zoom have a question, please unmute yourself and ask your question so we can answer. And we can hear you. I think this person is. Yeah, I see.
Any questions?
Do you have any questions about how this program works? And yes.
The follow-up's really good because I went through the program, and what you guys follow-up's really good.
I'm sorry, I didn't get.
Follow-up has been really good. I've been doing it online.
Oh, I'm so glad to hear that.
I've been doing the Parkinson's one though because the loud crowd, not you guys, but the one from Texas sends me a text every week.
They do. Well, I hope you can join us with.
Yeah, you just called me the other day.
Oh, good. I'm glad.
Somebody else I want to join with me.
Excellent. Please bring them a case history form. I'll give you my card. They can just call my cell phone. And I will get anybody in who needs to get in September. The start date would be September 5th. And then for you'll be starting with us in the 6 weeks. Oh, right? Because.
Well, I haven't decided yet.
Oh, okay.
I probably need to go back around and start part one again.
You would. I think that would be the best bet, if
Because
possible.
mine was during COVID. And
Yeah.
I remember.
Yeah.
I hear you pretty well all the way over here.
I know.
So
Yeah.
great.
Yeah, it was a great program.
Good.
I was a lot louder before.
You know, and I think that, like they said, refreshers are commonplace. And we even ask clients to return to our refresher every so often. So if it's been a while since you've been with us, which it has, it's a good idea to come back and rejoin the speak out portion before coming to our loud crowd. That's probably the best bet.
I appreciate it.
Of course.
I think we have someone on Zoom. Let's see if he has a question.
Okay, I see that you have a question.
Is there someone on Zoom who has a question? No? Maybe not.
Okay. Anybody on Zoom have a question? Alrighty, okay. No questions on Zoom? Anyone else? Of course. Anyone else? Yes.
What time do you guys
Oh, that's a good question.
Repeat.
We have a person who asked what time our program runs, and we're very consistent because we know our clients are busy and they're involved in a lot of different activities. So when you join Speak Out and you're with us for the first time, it is on Mondays and Wednesdays at 10 a.m. And then when you come to our Loud Crowd, it's Mondays at 10 a.m. And it's like that every spring, every summer, every fall, so that if there is a conflict, you know when we will be meeting ahead of time. Good question. Thank you.
I think you should explain the parking arrangement.
Yes, our campus, we are obviously on a university campus at Fresno State. You get a free parking code that you can use. You do have to go to a kiosk, and we've got a map that will show you where you don't have to get out of your car in order to get a code. You take the code, we show you where to park, and there's also a bank of handicap spots. So if you have a placard, you're welcome to park there, which is as close as you could possibly get to our building. It is a little bit of walk to our building. We do have a wheelchair. We've had some people who really find that walk is too much. So we'll come and get you from your car. I understand that it's a trek for some. But yes, you get free parking. You just have to get the code, and we'll show you how to use that and where to go for that.
It is on the second story, but we do have elevator access as well.
We do. We have elevator access, absolutely.
Anything else?
If they're practicing at home daily, how long should their practice be?
The sessions, I think, for Parkinson's Voice Project are about 30 to 35 minutes each time. Sometimes they'll shrink it down a little bit, but it's about 30 to 35 minutes.
She was asking how long they should practice at home. How long their practice sessions at home?
Yes.
Is that what you were answering?
Yeah.
Okay.
So if you're using the Parkinson's Voice Project videos or you're practicing at home, it's about 30 minutes at home. Some people will break it into 2 15-minute sessions during the day, which means it'll allow you to go through one lesson once and then another lesson once. And that is how typically people will do it. Or they'll do one 30-minute session, typically in the morning when they're feeling the strongest. Yeah. Our sessions are going to be around 35 minutes for the first 6 weeks. And then after that, it'll be a 50-minute group situation because we're doing more social activities and are able to do more, fun things in the group. Okay. Again, you can go to our website and get our case history form and submit that to us at your convenience. There is an address and an email address and a U.S. Postal Service address on the top of the form, and that's the best way to get it to us.
Thank you.
Thank you, everybody.
Hello, my name is Adam Perez. I'm a student physical therapist at Fresno State University. I'm currently doing my doctoral project on Parkinson's disease. What we're doing is pretty cool. It's something new that's never been done before. We're analyzing the brain signals, seeing how they go from one hemisphere of the brain to the other hemisphere of the brain, and seeing how that affects Parkinson's disease individuals. So what is Parkinson's disease? Parkinson's disease is a neurodegenerative chronic disease that affects the motor function of these individuals. It can lead to poor motor control, tremors, rigidity. It causes movements when they aren't wanted, and it prevents movements when they are wanted. And there is also a loss in sensory, as well as increases in deficits in posture. It leads to poor quality of life, and it does affect those that are greater than 45, and 2 times more in men than it does affect women. What we know so far, through years of research, is that the basal ganglia inside our brain is what is mainly affected in Parkinson's disease individuals. The specific area within the basal ganglia, the substantia nigra, is in charge of releasing dopamine, a neurotransmitter that helps us move. It motivates the body to move, and without it, it can prevent that poor motor control, rigidity, unwanted movements, or excessive movements. More current research is looking into the corpus callosum dysfunction in Parkinson's disease individuals. What they're finding out is that this area is commonly affected in Parkinson's disease individuals, and it prevents both hemispheres of the brain from communicating with one another. And so it could either cause two things. One, there might be signals passing from one hemisphere to the other when we don't want them to, and that causes unwanted movements in a limb that we want to stay at rest. Two, it can prevent these signals from moving from one side to the other and communicating in order to coordinate to do unimanual tasks or bilateral tasks, such as I'm trying to open a cabinet while also reaching for a utensil. So my study is looking at the first option, and that is causing akinetic rigidity and can affect walking patterns. It could cause decreased stride in length, decreased speed, and freezing of gait. And so these are known as mirror movements. So what is a mirror movement? Mirror movements occur when you're trying to do a unimanual task, such as, let's say, I'm grabbing for this USB. In mirror movements, the other hand will also perform the same movement. And this is not seen just in the arms, but also in the legs as well. And so a visual example, as you can see here on the right, the solid arrow is pointing at an index finger. The individual is lifting the index finger. This is being done voluntarily. The person is intently trying to lift up that index finger. However, on the other side, on the left side, with the dashed arrow pointing at the index finger is also being raised up, but this is an unwanted movement. And that's because the signals are passing from one side to the other without any sort of inhibition and causing an unwanted movement. So that is what my study is looking into in order to combat the effects of poor limb coordination and poor unilateral tasks. There we go. And so the way we do this is through the use of a machine called a transcranial magnetic stimulation, or TMS for short. For this experiment, what happens, there's a coil that sends out a magnetic field to a certain area of the brain. That signal then passes to the other side, so let's say the right side of the brain that is in control of the left side of the body. So it would be measuring the right side of the brain, which sends a signal to the left side to a target muscle, and it'll cause the muscle to twitch. And it records this through something called a motor evoked potential. That's just a fancy term for us to measure that signal to see how excited that muscle is. And so during this experiment, the individual will be seated. As you could see, that young lady is seated. She's pressing on some sort of spring device. And what we will be doing is measuring the limb that is at rest. So that's not moving or pressing down on the spring, to see if that side is still being activated, to see if the signals are being released to the other side of the brain when we don't want them to. Okay? And the measurement is also recorded using electrodes. Again, that signal will be passing down to the limbs, and that electrode will send the information to the computer, and that's how we will be reading it. So the process of this experiment, first, you would come in. This will take place at Fresno State University. We have a lab there where we conduct the experiment. I will be giving more information as to the parking and the location and area. We will begin with medical history questionnaire and a specific TMS, or transcranial magnetic stimulation questionnaire, to ensure the safety of the participants. It is Very, very safe. However, there is 1% that could cause a seizure in individuals that do have a history of seizures. And that's why we exclude those participants from our study. The process of the experiment will continue. We'll have the individual sign a consent form, letting the participants know that they can back out of the experiment at any time if they would like. And all this information stays confidential. We will also be doing an intake assessment to assess coordination, check how the participants walk and move, and then we will actually be performing the experiment as the next step. So our inclusion criteria, or what we want to see as a candidate for our participants, are individuals that don't have any sort of ankle or knee surgeries, individuals that have full visual information intact. They're able to see the computer because we will be showing them a screen as we perform the experiment. And this is for both healthy and Parkinson's disease individuals. For our exclusion criteria, we ask that our participants don't have any sort of history of seizures or an immediate family member that does have a seizure. Also, we cannot conduct the experiment on individuals that have a pacemaker or any electronic device in their body. Again, we're working with an electromagnetic field, and that could cause a disruption of those devices. And then here is my flyer. This has a little bit information on it, a summary of what I already discussed with you, where it will take place, the type of participants we're looking for. They're both Parkinson's disease individuals as well as healthy subjects that do not have Parkinson's disease and that are over the age of 22. I do have a QR code here. If you could pull out your camera and then scan that code, it'll take you to contact information, which again will be confidential and will be sent to me. And then I'll reach out and schedule an appointment. The experiment process takes about 2 to 3 hours to complete. And then here is my email as well, in case you want to contact me personally instead of through the contact information form. Thank you so much for your time. And then if you have any questions.
It's just a one-time visit, right?
Yeah, just a one-time visit. Mm-hmm.
And how long are you doing this for? How long is the
It should be until maybe September of this year. Ideally, we're going to start recruiting more subjects in July, and that's when most of the experiments will be taking place. But yeah, through September. Mm-hmm.
Is a knee replacement exclusionary?
Yeah, unfortunately, if you've had a knee replacement, we won't be able to perform the experiment. But yeah, any sort of metal in the body, because it is a magnetic field. If it's a small pin, then that's totally fine if it's in the lower extremity.